Less than 20,000 cases of ALS are officially diagnosed in the United States every year. Amyotrophic lateral sclerosis affects more than just the individual diagnosed. Only 47% of our class knew that 20,000 cases per year were diagnosed. Others thought it was higher or lower. My uncle was diagnosed with ALS in 2016. Throughout the next few minutes, I will talk to you about the signs and symptoms of ALS, how ALS affects the individual diagnosed, and how life changes for the family after the diagnosis. According to the Amyotrophic Lateral Sclerosis Association, the most common signs and symptoms of ALS include muscle weakness. This is a drawing of a normal motor neuron in an everyday individual's body, and this is the motor neuron of an ALS individual. Other symptoms include muscle spasms and potentially the loss of ability to speak, eat, move, and breathe. Now that we know the signs and symptoms of ALS, let's talk about how the individual's life changes dramatically. Due to muscle weakness, the individual will end up wheelchair-bound. From personal experience, my uncle has officially had to put in an elevator into his house due to being only able to move by wheelchair. In this class, 100% of you agreed with the statement I provided in my audience analysis of that amyotrophic lateral sclerosis is a life-changing disease. Your muscles begin to die off, or atrophy, and weaken, which causes the individual to have dead weight and allowing them to not be able to fully function like they used to. The individual also has to make life-changing decisions. Does the individual want to have a tracheotomy put in and require 24/7 nursing care? Does the individual want to continue the financially expensive medications that will help them get better? These are all decisions that an individual has to create in order to sustain or live comfortably with the disease. Now that we know how the individual's life changes, let's talk about how the family's life changes after the diagnosis. According to the article, The Family Experience of Living with Someone Who Has ALS, did a study done in Italy back in 2015. They asked various participants who had family members diagnosed with ALS and asked how life was with the individual. Participant number 7 of the study stated, "I felt sick too. I felt like I could not walk, breathe, or swallow, as if the illness was contagious. It's a family disease. It's a disease that devastates the entire family, not only the patient themselves. Since there is no official cure for ALS, the individual has to make decisions along the way, but the family also has to slowly watch their family member die." In conclusion, amyotrophic lateral sclerosis, or also known as Lou Gehrig's disease, affects more than just the person diagnosed. I've talked with you about signs and symptoms of ALS, how ALS affects the individual diagnosed, and how the family's life gets changed after the official diagnosis. Catherine Royce, who is a famous author, who is a patient with ALS. I end with this quote from her. "I realized that, like everything else in life, attitude and perspective are everything. Well, I know that I cannot control what ALS is doing to my body, but I can certainly control how I feel about it. If I decide it's the worst thing imaginable, then it will be. Conversely, if I see this illness as a gift and a blessing, that changes everything.